It is difficult. People come to us and they come in the door and they know why they're here 9 times out of 10. So that anxiety is palpable as soon as they get here and get in a room. And, the first thing to do, typically for new people, if I get an opportunity, I walk in and welcome them. I'm usually the voice they've heard on the other end of the phone before they get here. So they're a little comforted by hearing a friendly voice and seeing a friendly face. And that sets a tone for we're here to support and here to help. Obviously, it's the neurologist who gives the diagnostic opinion, and the multidisciplinary team here then follows. My role here is typically the social worker is the last person to see the patient because we wrap up and go over the enormity of the information that they've just received. Most people, obviously it's shocking, even if you're prepared for the information when you come, it doesn't make it any easier to hear. And so the first thing that we tell patients is it's okay to be upset. It's okay to be scared. All of those things are normal reactions. What you're feeling now is completely normal. We try and reassure them the fact that they are in the right place. For ALS, one of the things we know that is the most effective intervention is to be followed by a multidisciplinary care team. And I talk about faith, confidence, and trust in your care team a lot with our new families. That we're partnering with you on this journey. You are not alone. There's always somebody that you can call. If we don't know the answer, we'll do our best to find it. But you are not on this journey by yourself. We'll be here with you every step of the way, giving you guidance and support to make sure we're staying one step ahead and we're fighting with you, however you choose to approach it, right by your side. So, those are the kind of initial conversations when we first meet folks. I also encourage them to give them permission to adjust. So, we don't assume that you're going to be able to walk out the door and go back to life as normal because that is not feasible for most folks. I tell my new families, plan on probably about 6 to 9 months before you feel like ALS isn't the first thing you think of when you wake up and the last thing you think of before you go to bed. There is an adjustment time, just like you adjust to having a new baby in the house. You don't, the next day go, I know exactly what I'm doing and here I go. There's a learning curve with this disease and you do eventually adjust over time. The challenge is there's a little bit of a moving target because they're changing right along with you, like a baby does. They change and things change from day to day and you're constantly trying to adapt and learn and do your best. You will make mistakes. There will be moments of joy, there'll be moments of fear, there'll be moments of sadness, but those are part of any journey. And it's important to keep that all in perspective, find the joys, acknowledge the difficulties, embrace all of the help, assistance, support, and love that you can, and find what sustains you. Knowing that we may need to tinker and change and adjust over time.